Good morning and welcome back to Self-Care Sundays. My name is Dr. Kristen and I'm a physiotherapist here at 3 Pillars. Today, we are going to be talking about the 6 ways that the spine moves and how important it is to maintain adequate mobility and stability in each of the directions. The spinal column's job is to protect our spinal cord and spinal nerves, as well as to transmit force from our pelvis to our head. It is comprised of 33 vertebrae over 5 segments, 7 in our cervical spine or neck, 12 in our thoracic spine or mid-back, 5 in our lumbar spine or low back, and then fused vertebrae, 5 in the sacrum and 4 in the coccyx. The 6 ways that the spine move are flexion or forward bending, extension or backward bending, side bending to the right, side bending to the left, and rotation to the right and to the left. I invite you to do a gentle appraisal of your spine and how it moves in each of these directions. Maybe noticing differences from side to side or in any specific direction itself. It's important to notice these differences or tensions, restrictions, because if there is restriction in your mobility in your spine, as well as how stable you feel moving through that range, because if there is, then this can lead to compensation either above or below the area of restriction, as well as side to side. If one side has better range than the other, your spine is asymmetrical. This can ultimately lead to dysfunction and pain. Today, we're going to be moving through the 6 ways of spinal movement in quadruped or on all fours. We're going to use our breath to help assist us in not only expanding and creating space, but also helping us to create stability and ease in each of the directions. I invite you to either have a mat, a carpet, or a blanket underneath you, maybe an extra blanket for cushioning the knees, and for the rotation component, a bolster or a couch cushion or a blanket even rolled up. Bring your hands stacked under your shoulders and knees, stacked under your hips, and come onto all fours. Maybe spreading the fingers apart wide, rotating outward or external rotation to the shoulders to keep the shoulders steady and locked in, and maybe a gentle traction of your knees apart to engage the glutes. We'll begin with flexion and extension. On your next inhale, I invite you to slow and controlled drop your pelvis or your belly button down towards the mat. We're leading this from the pelvis and the mid-back and the chest lift, raising your head to come into spinal extension. And then again, leading from the pelvis, pull the belly button up towards the spine, engaging the abdominals, squeezing the glutes. And then comes the mid-back, the upper back, the head and neck to tuck and look at your belly button. On your next inhale, slow and controlled, lower through the belly button down to the floor. Next comes the mid-back, upper back, neck and head. And then again, leading from the pelvis, exhale, pull the belly button up towards the ceiling. Round. I invite you to go through 2 rounds at your own pace, at your own breath, imagining that each vertebrae is moving one at a time, moving so slow in order to feel maybe where one of the restrictions or an area of restriction that there might be. On your next inhale, come to your neutral spine and notice how your spine feels suspended in this position. Again, maybe spreading the fingers, gently pulling the knees apart, and engage through the abdominals to support the suspended spine. That's a tongue twister. On our next inhale, I'll invite you to bring your right shoulder to right hip, creating side bending or a C curve in your spine, compressing through the right side and expanding through the left side. Using our breath here, I invite you to send your breath to the rib cage on your left side. Creating space maybe where there isn't space. And noticing if as you breathe and you exhale, can you bend a little further? Did the breath create space? On your next inhale, back to center, maybe a breath in the middle, and then on your next inhale, bring your left shoulder to left hip, now compressing through the left side of the spine and opening the right side. Be careful here to make sure that your head isn't over bending. Keep it in line with your sternum or your chest bone. A lot of us have the tendency to move through our head first. We want to focus also on the rest of the spine and allow the head to follow suit. Breathing into the right rib cage here. Creating space. On your next exhale, return to center. At this point, if you need a break, roll your wrists out, maybe come off your knees. As you feel ready, we'll return back to all fours. The last two ways that the spine moves is rotation. And this is where I invite you to have the bolster or couch cushion, rolled blanket, something to support you if when you rotate, you can't find your way all the way to the ground. We'll begin with the left hand. I'll have you reach your left hand up past your chest, up into the ceiling. And if it feels good, you can turn your head to look at your wrist in your hand, or you can keep your head straight forward if it's too much on the neck. You'll dive your left hand down and under your chest, behind the right, coming into a rotation, and maybe resting your shoulder, your ear on the bolster or on the floor. In this position, I'll invite you to take the hand that is threaded underneath you to your right rib cage. Here we'll send the breath to your right rib cage, and using your hand as that feedback for you, send your breath into it. If that allows you to find ease, keep breathing into the right rib cage, or if you'd like to explore breathing into the left side to see if maybe that can give you more ease or space. Breathing in now to the left rib cage. See if it allows you to twist further. Breathing into the left. And on your exhale, wringing out the towel that is your spine a little bit further. Again, gentle reminder to maintain just a bit of gentle engagement through the abdominals to keep the spine supported and stable in these ranges of motion, knowing that stability is equally as important as mobility. On your next inhale, push through your right hand to lift your spine, reverse the rotation, and bring that left hand back up to the ceiling, again looking at it or keeping the gaze forward and bringing the hand back to meet the right. Checking in side to side, how does your left side feel compared to your right after that rotation? It's important to check in side to side, as you may notice going through the motion what it feels like compared to the side that hasn't gone through it yet. On your next inhale, I invite you to bring your right hand up to the ceiling. Again, gaze forward or gaze at the hand. And then dive that hand down underneath your chest and behind the left to come into rotation to the left. Resting shoulder and ear either on the floor or on the bolster underneath you. Bringing your right hand now to your left rib cage, let's expand with the breath. Does this allow you to rotate further, breathing into the right? If so, keep going. If you'd like to explore the sensation breathing into your right rib cage, I'll invite you to do that now. Sending the breath into the right side body and seeing if it allows you to rotate any further. On your next inhale, push the ground away through your left arm, bringing the right back under your chest and back up to the ceiling. And I invite you to bring it back down to meet the left. Shifting your hips back to come out of quadruped and onto your knees, or any way you'd like to transition safely back to a comfortable seat. Check in with your spine. How are you feeling in this new orientation to gravity? Maybe going through that appraisal again and sitting of flexion, extension, side bending right, left, rotation, right, left. What do you notice after we've moved through these ranges of motion, after we've used our breath to help create some more space? This is a great exercise to do in the beginning of your day, when you first wake up, to introduce these movements to your spine, getting it ready for the day ahead, and using your breath to create space and mobility in an area that might have been stiff or stagnant while you slept. As a gentle reminder, if you'd like to dive deeper, Dr. Tori will be leading the Art and Science of Relaxation the first 2 weeks of November, November 5th and 12th. And our massage therapist, Christine, will also be running a workshop for self-massage for health and well-being, in which she will guide you through different techniques to release tension throughout various points of your body. Until then, thank you for joining us and have a great day.